Good evening, everybody, and a very warm welcome to my dear students to our channel. So, let us continue the etiology of stroke. We had seen the various classifications of stroke the last time. Now, we'll continue according to etiology. We classify stroke into either ischemic stroke or hemorrhagic stroke. Ischemic stroke basically occurs due to interruption or occlusion of the blood supply to the brain, whereas hemorrhagic stroke mainly happens due to bleeding out into the brain tissues. Now, further, the cause of ischemic stroke is defined according to three causes, that is, either it is atherosclerosis, cerebral thrombus, or cerebral embolus. Now, what are these terms? We'll see each of them. What do we mean by atherosclerosis first? Athero refers to your arteries or your blood vessels. Sclerosis refers to hardening. So in atherosclerosis, there is hardening of your blood vessels of the brain. Now, why does this happen? This happens due to deposition of fatty plaques inside the lumen of the blood vessel. So let us see how atherosclerosis looks like. This is how it looks like. This is a normal, on the left hand side, a normal artery is shown. And then on the right hand side, atherosclerotic artery is shown. You can very well see the yellowish colored plaque deposition in the lumen of the artery. And obviously that yellowish colored plaque which is deposited will block the blood supply from that artery. And obviously it will be supplying some regions, so there the blood supply will be less. So this is how a plaque is formed, and it leads to hampering of the blood supply to one of the areas of the brain. This is the second picture showing thrombus and embolus. Now what is thrombus? Thrombus is nothing but the clot which is formed within your blood vessel. You can also call thrombus as a clot, and embolus is a moving or a traveling thrombus. So if the piece of the thrombus just breaks out and if it is traveling into the bloodstream, then that can be called as an embolus. You can very well see in this picture both the blood clot, that is thrombus, and the piece of that blood clot which has just detached from the thrombus and that is circulating as an embolus. Both of them are equally dangerous. Obviously, such a thrombus, if it is there within the lumen of the blood vessel, it will not allow the blood flow to happen normally. It will occlude or it will stop or interrupt the blood supply. So, thrombus and embolus and atherosclerosis are the main causes of ischemic stroke. So, if you imagine that your brain's blood vessels are blocked by such fatty deposits, they are blocked by such thrombus or embolus, then it will obviously cause ischemia as well as infarction in the brain. Ischemia is reduced blood supply, and infarction is death of the tissues due to reduced blood supply. We had discussed last time that our human brain continuously needs blood flow, right? We had seen that how brain requires glucose and oxygen both continuously, and if at all it does not get adequate quantity of glucose and oxygen, then the tissue of the brain starts to die. The second is hemorrhagic stroke. In hemorrhagic stroke, again, you have the causes of hemorrhagic stroke, that is aneurysms and AVM. Now, what does AVM stand for? AVM is arteriovenous malformations and aneurysms. Let us go through what are these two things. This is aneurysm. I had told you last time that there is some congenital abnormality in the blood vessels of the brain, in the wall of the blood vessels of the brain. That is known as aneurysm. You can very well see here there is saccular aneurysm, fusiform, and ruptured aneurysm are shown over here. Saccular, the name itself suggests it is sac shaped or it is circular in shape. The first one is saccular aneurysm, then the second one is fusiform in shape, and the third one is a ruptured aneurysm. So basically, what do we mean by aneurysm? Aneurysm is nothing but ballooning, a balloon shaped deformity which is formed in the wall of the artery. That is aneurysm. Now, why does this balloon-shaped deformity? It's not common to find aneurysm, right? It is not very, not every blood vessel, not every individual's arteries will have such ballooning. Why only some people have this kind of ballooning? And like I said, it is congenital, means it is present since birth. Many people don't even know about it until and unless it ruptures and causes bleeding into the brain. So, aneurysm, the basic cause of aneurysm is there is missing one of the walls in the blood vessel is missing. So the blood vessel is made up of basically three walls, external, middle, and inner wall. Now imagine the middle wall is missing in some person. Then what will happen? The muscle layer is not there. And that is why this kind of ballooning shaped deformities do happen very commonly in those persons. Imagine that somebody does not have a muscle layer, the middle layer, which is the muscle layer in the blood vessel wall. It is absent since birth. Then what will happen? It can lead to such balloon-shaped aneurysm deformities. And once these aneurysms, they'll grow, and once they'll just rupture. And when they rupture, they cause massive bleeding into the brain tissue. And that is nothing but a hemorrhagic stroke. So basic cause of hemorrhagic stroke. First one is this aneurysm. What is an aneurysm? Ballooning or fusiform shaped deformity in the wall of the blood vessel. There is dilatation, ballooning, fusiform shaped aneurysm. Why does this aneurysm happen? Because of the missing tunica media, that is the middle layer of the blood vessel wall is missing, and that causes such balloon shaped deformity in the wall of the blood vessel. This is the second cause of hemorrhagic stroke, arteriovenous malformations, AVM. The short form is AVM, arteriovenous malformations. We all know the basic circulation details, right? Arteries are there which carry oxygenated blood. There are veins which carry deoxygenated blood. In between the two, there is a group of capillaries which causes communication between the arteries and the veins. Now, this is how normal blood vessel, on the left hand side, the one which is shown is normal blood vessel. So you have such arteries, the red ones, the blue ones are your veins, and in between the two, there is a network of capillaries. Now, what happens in case of somebody has AVM, arteriovenous malformations? So you can see there's abnormal connection of the blood vessels. It's not very smooth. The capillaries on the left hand side, you can see they're so smooth and uh, properly arranged the way they should be. And on the right hand side, you can see when there is malformation. What do we mean by malformation? Again, malformation means in the formation there is some issue, there's some mistake in the formation itself of these blood vessels. Means obviously this also will be somewhat congenital. So arteriovenous malformation, if some person has, then there is an abnormal connection between the arteries and the veins. It is not very smooth via the capillaries, which is shown on the left side. It is very abnormal the way it is shown on right side. And now imagine this kind of abnormal connection which is there. If it bursts or if it breaks, again it can cause massive bleeding into the brain. So two major causes of hemorrhagic stroke. One is this aneurysm, ballooning or fusiform shaped deformity in the wall of the blood vessel. And the second one is aneurysm. There is abnormality, tortuous capillaries are there, dilated capillaries are there, abnormal blood vessel connection is there, and even that aneurysm and AVM, both of them can anytime break. Arteriovenous malformations can also anytime break or rupture and cause bleeding. And the same way, aneurysm can also, the one this is shown is rupture aneurysm. It can also rupture. Imagine that balloon gets big, and once it bursts. The similar way, this aneurysm gets big, and then one day it bursts. So that can cause massive bleeding into the brain tissue. The bad thing with these aneurysms is they are asymptomatic many times until and unless it ruptures and leads to bleeding, and then that blood, uh, which is collected within the brain tissue, causes rise of the intracranial pressure, and person suffers from high intracranial pressure symptoms like headache, vomiting, nausea. That is, a stroke only comes and no other prior symptoms are there. The person directly suffers from a hemorrhagic type of stroke, bleeding into the brain, and that causes headache, severe headache. Usually, what these people have is the severest headache of their life, the most severe one. The headache is not normal. If there is a rupture of the aneurysm and there is massive bleeding into the brain, You know that brain has an outer covering which is skull, and the brain does, and even the brain is covered by meninges. So there is no space basically within your brain tissue. So where will that excessive blood go? It will not go anywhere. There's no route for that excessive blood. So it will create increase in the tension within the brain, and a lot of headache, severe headache will be there. So this is hemorrhagic stroke, one of the cause, aneurysm, and this is another cause, arteriovenous malformation, AVM and aneurysm. So that's for the etiology of the stroke and further causes in that ischemic strokes cause and hemorrhagic stroke cause. Now let us go on to the very important point, which is the risk factors for CV stroke. Very, very important for us to note all these risk factors, because then only we can advise our patient that what they should do and what they should not do. So the first and foremost risk factor for CV stroke is smoking. Smoking a cigarette contains nicotine, and nicotine deposits like this within the blood vessel wall, the way it was shown here. Nicotine deposits are also found many times. Can you see the yellowish one? These are the fat. In the similar way, nicotine deposit can also happen in the blood vessel wall, and that can block. In short, if the nicotine deposit or fatty deposit happens in the blood vessel wall, it is obviously going to cause a blockage in the circulation. So smoking kills, right? Isn't it? We see that many times in ads and everything. Smoking kills. This is the reason. Nicotine is the basic cause. Next is obesity, a very, very dangerous metabolic disorder. Obesity. Obesity is on the rise, especially in case of youth. The youth of our country, most of the time, they are not that active. They're just into their phones. And sedentary lifestyle in case of adults has led to increase in the chances of obesity. So again, obesity is a pre-morbid condition. It is classified as a pre-morbid condition, morbid condition. Why? Because obesity can lead to multiple diseases and ultimately it can kill the person. So one of the risk factors of stroke is obesity also. Obesity can cause heart disease, brain disease, so many other peripheral vascular diseases. So, in short, you can say that one thing leads to the other thing leads to another thing, and ultimately that hampers the life of the person. Lack of exercise. I told you already about sedentary lifestyle. We all have this issue nowadays, sedentary lifestyle. We do not work that much. We usually have desk jobs, or we don't even exercise. So this is the basic root cause of many problems. Lack of exercise, obesity. One thing leads to the other. I already discussed. Lack of exercise causes excessive fatty deposition within the body tissues, organs, and that can lead to obesity, and obesity ultimately can lead to heart attack, brain attack, or stroke, etc. So lack of exercise and sedentary lifestyle. It is very, very, very important, utmost necessity of today's generation to be active. Diet containing excess lipids. This is another risk factor for stroke. Excessive lipids, fats. If your diet has disproportionate fat, it has higher amount of fat, and especially we talk about the bad cholesterol, the bad fat, right? The bad ones which we are not supposed to eat, that is more in your diet, then this is again a risk factor for stroke. You may not suffer suddenly, but in your later ages also it can lead to increased chances of stroke. So diet which is containing excessive fat, we also have some amount of fried food, but if it is excessive, then that also is harmful, can cause stroke. Next is alcoholism. Alcohol, again, if it is in excessive amount, causes liver damage, and we know that our fat metabolism happens due to liver. And if the liver metabolism itself is disrupted, then fat metabolism will not happen, and that can lead to excess deposition of fat in other uh, organs, blood vessels, and that can cause stroke or brain attack. Diabetes, hypertension, these two things, all these are non-communicable disease. These category of diseases, non-communicable disease, but they are dangerous. Although it does not spread, they are not communicable, but very dangerous. Diabetes hai, hypertension hai. Both of them are equally dangerous. The metabolic syndrome, that is obesity, diabetes, hypertension. If anybody has all of the three, high cholesterol levels, high blood pressure, also a person has diabetes, then all those are a very, very big risk factor. I'm not saying that everybody who has diabetes or BP should worry. No, there's nothing to worry, but you should be precautious. Always be careful. The hypertensive patients are always advised to be careful with their medications, the dosage, not to skip any medications. Then the diabetic patients, same way, they should be also aware of their blood sugar count and should try to keep it in a narrow range. You can control diabetes. I'm not saying you can cure it, but you can control diabetes by so many options. Where you have physical activity, you have yoga, you have exercise, aerobics. So there are a lot of physical activities by which the blood sugar level count can be kept in check. Hypertension, that is the blood pressure. If there is increased blood pressure, that can cause again damage to the blood vessel wall. Hypertension, how is it harmful? Increased pressure. Imagine there is a pipe which is carrying water with a certain amount of pressure, and suddenly the pressure doubles, triples, or pressure rises in that pipe. The pressure of the water in the pipe rises. Obviously, it can cause some damage to the wall of that pipe, isn't it? So, similar way, our blood vessels are like pipes which are carrying blood. It is going at a certain normal level of pressure. Now, suddenly, if there is rise in that level of the pressure in the blood vessel wall, it can cause damage to the blood vessel wall easily. So, these are all the risk factors for stroke, and it is our duty, moral duty, to keep these risk factors under control. And when we are talking about this lipid, diet containing excessive lipid, do remember that we have two types of cholesterols. Lipid, basically, cholesterol is also basically lipid. So you have two types of cholesterol. One is HDL, another is LDL, high density lipoprotein and low density lipoprotein. We also have VLDL, that is very low density lipoprotein. So now if we talk about HDL and LDL, HDL is good cholesterol, LDL is bad cholesterol. We also have HDL LDL ratio, if you know, right? So more the good cholesterol presence in our blood, it is better, and less the bad cholesterol, that also is better. So more HDL and less LDL and less VLDL is a better situation. It is a very good situation. And imagine the opposite, less HDL and more of LDL and VLDL. Low density lipoprotein count has increased, or very low density lipoprotein count has increased, and HDL count has decreased, then that is not a good situation. So HDL is good cholesterol. It does not deposit or cause a plaque formation within your blood vessel wall. So it is good for your health. And LDL, on the other hand, causes plaque formation and deposition in your blood vessel wall, which is the bad cholesterol. So you should be aware of this HDL LDL ratio, and HDL should be more, LDL should be less in your cholesterol levels in your blood. There are certain foods which provide you HDL, and that is why nowadays we always have this concept in cooking also, that keep changing your oils. Certain kind of oils will give you certain nutrients, and it will provide you with good cholesterol, not the bad one. And certain kind of oils are responsible for providing you bad cholesterol. So it's said nowadays that use different oils, cooking oils. The sunflower oil is a good one. Then you have olive oil, which is again a good one, but not everywhere it can be consumed. So it is better that if you are not able to consume the other good type of oils, but at least it's better to keep on changing the oils. That is what is said. That is what is said to practice. So those are all risk factors. What are the warning signs of stroke? This is important. Many persons, if they are having ischemic stroke, their body does give some signs and signals earlier. Because, like I said, ischemia is a slow process. Slowly, the fats will deposit within the blood vessel wall. Slowly, they will occlude the blood vessel, and the circulation will be occluded slowly. And that's why your brain has still some time to give you the signs, right? धीरे धीरे करके blood vessel की wall जो है वो occlude होने लगती है due to fat or due to some other depositions. And so your brain does give you some signs and symptoms. The brain tissue does not die suddenly over here, it dies slowly. Because slowly the blood supply is getting less. Ultimately, if there is complete clot or complete blockage, which is like shown over here in the last picture, completely if the wall of the or if the lumen of the blood vessel is blocked, no blood reaches that area, and then that area starts to die. So the area of the brain which is supplied by these blood vessels starts to die. So what I mean to say is if it is an ischemic stroke, it does give some signs and symptoms, some warning signs. But on the other hand, hemorrhagic stroke may not give, because like I said, hemorrhagic stroke is due to aneurysms, AVM, that is arteriovenous malformation, and those two things, they may be present since birth, but the person does not realize unless and until it ruptures and causes bleeding and headache and etc. Rise of intracranial pressure, the pressure within the brain rises. Until and unless that happens, the person may be asymptomatic. So that is why hemorrhagic stroke becomes dangerous. उनको पता ही नहीं है कि उनकी ब्रेन के जो ब्लड वेसल है उसमें जो वॉल्स है उसमें बलून जैसा कुछ स्ट्रक्चर फॉर्म हो चुका है. नोबडी इज अवेयर. और पहले कभी कोई सेरिब्रल एंजियोग्राम करवाता नहीं है, क्यों करवाएंगे? द रीजन इज पर्सन को कोई सिम्टम्स नहीं है, तो वाई डज somebody go for any investigation unless they don't have any symptoms, right? So that is why hemorrhagic stroke becomes dangerous. Person is unaware. But ischemic stroke does give some warning signs. Which are those warning signs? The blood supply धीरे धीरे करके वो occlude हो रहा है. तो patient को धीरे धीरे करके कुछ weakness आएगी. So first warning sign is sudden numbness or weakness of the face, arm or leg, especially on one side. So hemiplegia, we already talked about that. Hemiplegia means paralysis of one half of the body. Hemi is one half, Asia is paralysis. So suddenly, if your one half becomes weak, if it becomes one half means we are talking about one arm and one leg and one half of the face. If it starts to become weak or there is some numbness, weakness in that region, one half of the body, then that is another one sign of stroke, warning sign. Which is another one, sudden confusion, trouble speaking. Many people have the speech difficulties because the blood supply to that area of the brain which is responsible for speech has got disturbed. So person may have speech disability, trouble speaking, confusion, trouble understanding. Many people have also this trouble of understanding because, like I said, brain has so many functions. Your speech, your understanding, your thinking, your emotions, everything is related to your brain. Okay, so if somebody has suddenly, they were normal before and now suddenly they have some slurrings of speech. What do we mean by slurred speech? The person will have so many pauses in between. They have intermittent speech. It is not continuous fluent speech. Okay, so slurred speech, if it is there, confusion is there, difficulty in understanding things, difficulty in speaking out things. All these are the warning signs. Sudden trouble seeing, vision loss, speech loss hai, vision loss hai, that also is another warning sign of stroke. Sudden trouble walking, dizziness, loss of balance or coordination. Many times stroke presents as the person just loses balance, falls on the floor and then is unconscious. So this is also one of the warning signs. Many times persons have this, right? That they feel dizzy. They feel like they'll fall while walking. Now, dizziness has multiple causes, but we have to rule out one cause, that is stroke. Sudden severe headache with no other cause. So this is again a possibility with hemorrhagic stroke, that there is rise of the intracranial pressure and suddenly there is, if there is massive bleeding into the brain tissues, then suddenly the person starts to have severe headache. So these are all the warning signs of stroke: numbness, then confusion, speech, vision difficulties, difficulty with balance, coordination, and headache. What is the normal blood flow to the brain? 50 to 60 ml per 100 gram of brain tissue per minute. And this is constantly given to the brain. 50 to 60 ml उसको चाहिए और 100 ग्राम of brain tissue per minute. सिर्फ 100 ग्राम ब्रेन का टिश्यू लेते हो आप, उसको 50 to 60 ml ब्लड सप्लाई चाहिए 1 मिनट में. सो इमेजिन कि अगर उसका ब्लड सप्लाई आपने कम कर दिया या उसको स्टॉप कर दिया, देन ब्रेन इज वेरी वेरी सेंसिटिव. उसको इतना एक्सटेंसिव ब्लड सप्लाई मिल रहा है और अगर उसको कम मिलेगा या उसको बिल्कुल नहीं मिलेगा, देन द ब्रेन विल स्टार्ट टू डाई. Within 3 to 4 minutes, it starts to die. Now, the blood supply of the brain, it's a complicated topic. The blood supply of the brain is mainly by carotid and vertebral arteries. So we have carotid circulation and vertebral artery circulation, but we also have the circle of Willis, which is the major complex structure which is supplying the blood to the brain. So it is like a complex network of arteries at the base of the brain which supplies the blood to the brain tissue. So we will be discussing the circle of Willis. Until next time, you just keep on revising the things we have discussed till now. So let us keep till this circle of Willis. We'll be finishing in the next class. So today we just saw the variety of risk factors for stroke, and we also saw the causes of ischemic as well as hemorrhagic stroke. Cause of ischemic stroke was atherosclerosis, hardening of the blood vessel wall, deposition of fatty plaques within the blood vessel wall, and thrombus, embolus, again the cause of blockage and ischemia. And these are the causes of hemorrhagic stroke, which is aneurysm and EVM, arteriovenous malformation. And these are all the risk factors for stroke and the warning signs of stroke. So hope you have enjoyed the learning experience with me. And if yes, do press the like button and we'll meet the next time. So keep revising, stay happy, stay healthy, and do remember this channel is for the physio, by the physio, and of the physio. Thank you so much. I'm just signing off. Good night.